Mpox, formerly known as monkeypox, is a disease caused by infection with a virus known as monkeypox virus. This virus is part of the same family as the virus that causes smallpox. People with Mpox often get a rash along with other symptoms. The rash will go through several stages, including scabs, before healing. Mpox is not related to chickenpox. Mpox is a zoonotic disease, meaning it can be spread between animals and people. It is endemic or found regularly in parts of Central and West Africa. The virus that causes Mpox has been found in small rodents, monkeys, and other mammals that live in these areas. Discovery and history. Monkeypox virus was discovered in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox originally, the source of the disease remains unknown. Scientists suspect African rodents and non-human primates, like monkeys, might harbor the virus and infect people. The first human case of Mpox was recorded in 1970 in what is now the Democratic Republic of the Congo. In 2022, Mpox spread around the world. Before that, cases of Mpox in other places were rare and usually linked to travel or to animals being imported from regions where Mpox is endemic. The World Health Organization renamed the disease in 2022 to follow modern guidelines for naming illnesses. Those guidelines recommend that disease names should avoid offending cultural, social, national, regional, professional, or ethnic groups and minimize unnecessary negative effects on trade, travel, tourism, or animal welfare. The virus that causes it still has its historic name, however. There are 2 types of monkeypox virus, Clade 1 and Clade 2. Clade I causes more severe illness and deaths. Some outbreaks have killed up to 10% of the people who get sick, although more recent outbreaks have had lower death rates. Clade I is endemic to Central Africa. Clade 2 is the type that caused the global outbreak that began in 2022. Infections from Clade 2 Mpox are less severe. More than 99.9% of people survive. Clade 2 is endemic to West Africa. Risk of severe disease. Although cases of Mpox are not life-threatening, some people may be more likely to get severely ill, including people with severely weakened immune systems, children younger than 1, people with a history of eczema, people who are pregnant. Preventing Mpox. There are several ways you can protect yourself and others from Mpox, including avoiding close skin-to-skin contact with people who have a rash that looks like Mpox and animals that carry the Mpox virus. Learning steps you can take to lower your risk of Mpox during sex or at a social gathering. Getting vaccinated. Check with your healthcare provider to find out if the Mpox vaccine is recommended for you.